Good morning, everyone. My name's Meredith. I'm a first-year master's student in health management and policy and health behavior and health education at the Michigan School of Public Health, and I'm going to take you through my day today. I got my undergrad degree from UMass Amherst in 2019 in public health, but you don't have to have a background in public health to get your MPH. I have peers with backgrounds in psychology, social work, business, finance, a lot of different fields. I'm a dual MPH in HMP and HBHE because I want to work in sex education reform, which is both a political and programming issue, and I think having the background in both fields will provide me with invaluable experience and background. HMP is a community of truly wonderful human beings, both current students and alumni. Amidst being a fully remote graduate student, we've managed to become a really tight-knit cohort. I'm currently a fully remote graduate student living in New England. I have been to the University of Michigan once in my life, and I hope to be able to get back someday. So even though we're in a fully remote graduate school experience, I did mention that the HMP cohort is like so kind and amazing and wonderful, and we have a really amazing friendship with one another. So to help answer some of the questions, I'm going to be reaching out to friends in the program throughout the rest of the day, and we have the first meet and greet with one of the HMPers from our cohort right now. Okay, everyone, to help us answer a question that we've been getting asked a lot, which is how did we choose U of M, we're going to ask Rennie.
Hi, everyone. So back in the summer of 2018, I did the University of Michigan School of Public Health Summer Enrichment Program. And so as part of that program, it was a really great opportunity. I got to work with Michigan medicine and also spend a lot of time with my cohort learning about things like health equity and population health. And so that was such a great experience because I was learning about two things that I had very little experience with or exposure to, which was health administration and health equity. And so when I left that program, I just had such a strong support network, and I felt I wanted to come back to that in grad school too. And then not only that, I feel like Michigan offers a ton of resources that I can explore in healthcare and design, and the alumni network is great, so I want to come back.
Okay, so somebody just asked this amazing question, what's my favorite part of the week? And since Rennie is still here, I have to say that it's our cohort hangout, which is usually Wednesday or Thursday nights. We play games, we laugh, we vent, and just overall have a good time together amidst being fully remote. So Natalie's here to answer a question that's come through a couple times. Is it difficult finding research opportunities with professors?
Hi, everyone. So finding research can be a bit tricky. I think like cold emailing professors can be tough because they may or may not have research for you. Something I did was actually find research centers on campus, and there's a few with SPH. I was able to find one and email them, and they kind of have more set positions available. And then another way is also just, letting people know what your interests are, and eventually something might come up. Like I was able to be referred to a research position by a friend because she knew what I was interested in. So those are my recommendations.
Thanks, Natalie. Hi, everyone. To answer another question that's come through, Caleb is here to talk about school life balance.
Yeah, thanks for having me here. I think one of the most important things when discussing how to maintain your schoolwork and your personal life is to have clear communications with people that you work with about your time, and then also having hobbies that can help you to take your mind off of schoolwork. So, for example, I love sports, particularly Michigan athletics, and so I'm always trying to figure out what sports they have coming up, what games they have coming up, and I just use that to help me keep myself level-headed.
Awesome. Thanks, Caleb.
No problem. Go Blue.
Hi, everyone. Going along with today's journey of introducing you to many of the HMP students in our cohort, I have Sienna here, and we're going to tell you about the classes that we take together and the classes that we're also taking. We're both taking 8 classes, so that's a fun journey. So we're taking 3 classes together: economics of health, healthcare quality, performance measurement and improvement in the United States, and professional development. Do you want to tell the group what classes you're also taking?
So in addition to those, I'm also taking environmental health and policy, principles of epidemiology, nutrition and public health, health policy challenges in developing countries, and I'm doing an independent research project with an HMP professor.
Awesome. The 5 other classes that I am taking are health advocacy, sticky health communications, qualitative methods in public health, program evaluation in public health, and public health sciences in the environment. And of the 8 classes that I'm taking, my favorite is qualitative methods in public health because it's an independent research project. There's only 7 people in the class, and it's taught by Holly Jarman, which is an added bonus.
My favorite class this semester is my health policy challenges in developing countries class because it is an elective class for the global health track, which is a sub-certificate that you can get within the School of HMP.
Awesome. Well, thanks for chatting with the group, Anna. Appreciate it.
Yeah.
I applied to both HMP and HBHE via SoFast. I did have to pay the application fee for both programs. I was accepted to both programs and matriculated into both programs so that I could get 2 Masters of Public Health. A lot of folks are asking about financial aid and funding for master's programs. I am a scholarship recipient. I receive my scholarships like other SPH students at the time of my acceptance, and all other funding opportunities if you don't receive a scholarship at the time of your acceptance are through external grants, internal grants. Once you're at SPH, there are so many scholarships you can apply for. Could be wrong, but it's my understanding that all HMP courses are remote this term. I know that last term the environmental sciences MPH program had an in-person class or 2, and there has not been a decision about whether or not our courses will be in person next term. We're still waiting on hearing. In addition to taking the 8 classes that I'm taking this term, I also have 2 jobs on campus. They're both fully remote, but I work as the HVHE department assistant, and I also have a research assistantship. Some days are harder than others. Some days there are more assignments to do, more work to get done, but I just take it task by task, and I always have one day of the week where I do absolutely no work or school, a day just for me. My best advice for somebody applying to SPH is to be your authentic self, especially in the statement of purpose. Share why you want to be a part of the program, get an MPH or an MHSA, and share your love of public health.